Hi everyone. This month is World Endometriosis Month, and more importantly, as we come to a close of this week, it is World Endometriosis Day on the 24th of March. So today I'll be joined by Elsie Wandera, who is the founder of Endometriosis Foundation of Kenya, because we want to tackle what endometriosis is and give you guys a little bit of what you should know about endometriosis. This is Footsteps to Fertility, and I'm Dr. Endo. Keep watching. Hi, Elsie.
Hey.
So, this is Elsie Wandera. She is the founder of Endometriosis Foundation of Kenya. She is an Endo Warrior, and it's good to have you on this show. We've wanted to do this for a long time because I feel endometriosis speaks to us as fertility specialists. So it's really important to have you here, and welcome. I'd like you to tell us a little bit about why you do this and why you are so connected to endo.
Thank you for having me, by the way. And I think it's a pleasure to just be talking about this on your channel. So I first discovered that I had endometriosis when I was about 26 years old. And so this was after 9 years of pain, of living with pain. And just to put that into context, imagine with me, like at the age of 15 when my periods began, I used to be rushed to hospital. And, it was painful and insane cramps that, completely would paralyze me. I would miss school for a day. And, so I relied a lot on pain medication and those injections. And so, so I went through, life thinking it's normal, because even at the time, my mom would tell me, oh, I've gone through this. My auntie would tell me, I've gone through this, it's normal. In fact, your cousin has also gone through it, so it's normal. So, pain for me was normalized. But I think at that time when I just said enough, is enough. I think I need to see a doctor. When I went to see the gynecologist, he told the best way that he could describe for me that I was suffering with this condition called endometriosis was my uterus was growing inside out. Which was, I know.
That's an interesting description.
I know, but it was the simplest way he could describe it, because I was young, one, two, I think medically he was also trying the best that he could to try and make me understand what was happening. And because I couldn't understand, I was like, what are you talking about? Like and he's like, you know what, your uterus is growing inside out. And I was like, fantastic. So I thought it was so cool. I actually used to go around, and by then I was working, and I would talk about, my uterus is growing inside out. So it was such a big deal. So you needed to give me time off work. But I remember after that first surgery, he got out a cyst that was just about to rupture, so it was bleeding. And then, which is one of the symptoms of endometriosis, that was what told him that it was endometriosis. And so, after that, I had to get onto hormonal therapy. I was put on a drug, that suppressed the production of estrogen. And what that did is it made me menopausal. And you can imagine at 26 having to battle with hot flashes, mood swings, and all those issues. It wasn't fun. And I remember one of the things that, which we try to do as the Endometriosis Foundation of Kenya is try and demystify the myths. But one of the things which he was promoting at the time was, for me to get pregnant so that we can cure endometriosis.
I knew you were going to bring that up.
Dr. Ndegwa, you and I have been on panels. We've had this discussion together. I want to tell any woman who is out there who is suffering with any period pain of whatever kind, and you're going into a doctor's office and they're telling you that pregnancy will cure your endometriosis. It is a myth. That relief is only going to be for as short as 9 months, and it is not guaranteed, and I'm sure you can speak into that.
And yeah, and it is it's good that you brought that up, because it is a myth. I mean, endometriosis is a chronic condition. It is there, unfortunately, for life. So it's something that you have to manage. It does come back, and the pain does go up and down, and pregnancy and giving birth will not take it away. Absolutely. Unfortunately.
Yeah. So of course, after that, that I made it my mission. I was trying to get pregnant, and so I even chased away a boyfriend. So, and I apologized to him, and but anyway, going back to the discussion, so I thought that the hormonal therapy would actually, sort it out. But immediately I stopped. I finished the treatment, which was like about 3 months. I was back in the ER for jabs and shots. And I remember I called the doctor and I asked him, I thought you said that this would be sorted, but like you said, endometriosis has no known cure, no known cause at this moment. It's just about managing the pain. And so I also had, later on, the year 2014, I had my second surgery where they also had to remove another cyst. And, that was when I decided, you know what, someone has to do something about this pain. Someone has to tell the women that, one, this condition has a name.
Yes.
Secondly, they are not alone, because a lot of women are suffering out there in silence, and they're thinking, one, it's in their head, because a lot of doctors dismiss this kind of pain. They say it's all in your head, or like I was saying, get pregnant, sort it out. So no one seems to be taking us seriously. And so I felt, why don't you provide a space for women where, they would just feel heard, and that, and then find doctors who are passionate about the issue and who are also considerate of the patient. And so that's basically why I started it, just so that another woman out there doesn't feel alone the way I was feeling, and the way a lot of other women who are suffering with period pain are feeling, because it does come with its own issues, which I'm sure we'll talk about later.
Yeah, and so when did you start Endometriosis Foundation of Kenya? That's what, and what is your role? What is your task?
Yeah.
What do you do for the women who are in the foundation?
Okay, so we started the foundation immediately after my second surgery. Like, I remember, in fact, even just before going in for surgery, I was just like, I'm going to start a movement, and I will spread the yellow. So even some of the hashtags that you see on the page, on some of our posts, is about spreading the yellow, because yellow is the color of endometriosis. So we started, I guess, in 2014, and that's the conversation that I started with some of my partners. So I remember just talking to Esther Mbogwa, who is also another Endo Warrior, who's also got her own platform that she pushes. This conversation, we just thought, let's get women together. One, let's then also get them talking about what they're going through. And then let's redirect their energies from focusing on the pain to managing on just improving their lifestyle. Because we realize that the quality of their lifestyle is significantly impacted. So some of the things that we do, like we have a Facebook group that is closed. But again, it's a very, very delicate topic. A few women are willing to come out and speak about it, and I'm sure, with infertility, I'm sure it's the same thing. So we had that space, and we thought women would talk, but mostly what we do there is just share articles that have been written either by doctors or scientists who are just trying to find out more about endometriosis, so that they can be more informed, and they can be also responding to some of their issues from a place of knowledge. But then we also decided, okay, let's create a closed WhatsApp group. And that's what we also have, where we really just, we care for the women.
Yeah.
One, we listen to them, because it's a space where they can come and just really just open their hearts and speak up their issues and speak up some of the challenges that they're going through. But then what we also do is we ensure that we direct them to gynecologists, to ensure that they get definitively diagnosed with endometriosis. Because that's, and I'm sure you'll agree with me,
difficult.
It's difficult. It's not like, where you have malaria and you just draw out blood, and you get tested.
Yeah.
So we just make sure, as much as possible, try and get a doctor to actually say that this is actually endometriosis, because we do know that pelvic pain could be related to other conditions.
Very, very many other conditions. And so I that's really good. I like that you said lifestyle, because I also see a lot of women with endometriosis, and I think one thing that I try to stress is lifestyle and diet, because it has an important role in a lot of conditions, endometriosis being one. Tell me, Elsie, how have you managed your pain? How have you managed your endometriosis in terms of lifestyle?
So, like, one of the things which we keep stressing, and we tell the women in the group, is that endometriosis is a hormonal condition, and because it's a hormonal, there are moments where we will have cravings. There are days in a woman's cycle. A woman is craving chocolates, she's craving fried foods, she's craving the salty and savory foods, etc. And that's where our battle lies, because most of these foods aggravate the condition and just aggravate the pain and don't make it easier. The inflammation, exactly. So one of the things that we tell the women, and what I have also done, is stay away from red meat. Try as much as possible and stop dairy consumption, because we know that dairy is actually responsible for the bloating. A lot of people don't know that they are dairy intolerant. We love, like, I'm a lunje. I love my tea. I used to love my tea. My mom used to wait for me to get home so that we could enjoy a cup of tea. But now I can't take milk tea. I instead choose to actually take herbal teas. The other culprit for endometriosis warriors is gluten. So, and this is a conversation where when women hear gluten, you're telling me to stop eating mandazis, you're telling me to stop eating chapatis with wheat, bread, anything with wheat is also one thing that actually just aggravates the inflammation. So, so those are the things, then soy, because it's got a lot of salt and
estrogen. It's actually
estrogen. Exactly. So those are some of the things. So we just tell most of the women, if you are able to cut down on some of those foods and then find the alternative for, like, for example, if I have to take milk, if for example I'm not taking milk, I have to load up on my calcium, which I will get, like, for example, from broccoli and other foods, like
fresh fruits,
other fresh foods. And so because people say, like, oh, but all these foods are boring, but there are really interesting ways that you can actually
make them,
load up on your flavor and make them. And I'm really glad that we're talking about this, because I've got one of the things that the Endometriosis Foundation of Kenya has done is we've partnered with some nutritionists, and we also have them in the group to just help women be able to respond to some of those questions around, okay, fine, we know as the endometriosis warriors, we do need a lot of omega-3.
Yes.
Another critical nutritional piece that is critical for us endometriosis warriors is omega-3, because it really fights that inflammation. And omega-3, you can find it in fish oils, fish oil supplements, and other things, like, for example, chia seeds, which is great, like, when you do your smoothie. So that's what I do. So I'll put I'll get some chia seeds and put some of that in my smoothie. Or, like, for example, another question which I get a lot, okay, so Elsie, but if we are not taking milk, how do we make our smoothie? So there are things like almond milk, there's rice milk, hazelnut milk, there's cashew nut milk. And, it's interesting. So people are like, but those things are so expensive. But you know what? One, you can actually also make it from your own house. And but then the other thing is, we must prioritize our health as women. I think that's one thing which we don't do well. And that's why we are so comfortable in our pain. We are so happy talking about our pain and just telling the world that we're in so much pain. But what am I doing about it? And that's what That's why the Endometriosis Foundation is there, because we're about, okay, enough. There is 20% that the doctor will do, which is go in surgically, you know, and there's only so much pain medication you also want your body.
Take. You know, and which you can take, really.
Yes, yeah. So there's only so much that can do for you, but there's also what I can do, which is 80%, and that's diet and lifestyle. Yeah. So there's also exercising. I cannot add too much weight. One thing with endometriosis is the other symptom of endometriosis, and the other burden that it comes with is chronic exhaustion. Like, I'm tired. By the way, that's when I know, like, my periods are around the corner. I literally cannot do anything. I feel like I'm so exhausted. But one of the things which I do is I find what are my sources of energy now, also from foods, but not just any food. So like baobab powder is great for a source of energy. But then there's also exercising. So I used to walk a lot, and I say used to, and it helped me lose a lot of weight. But due to other reasons, other things are happening right now. But all I'm saying is we have to own and take responsibility for our health, and just ensuring that we don't allow this condition that is affecting over 1 million people, 176 million women around the world. It's important for us as women to prioritize our health. And not only physical health, but also mental, because you cannot allow an issue that is affecting 176 million women around the world to put you down.
Yeah, please talk about the psychological bit, because this is a chronic condition. There is extreme pain every single month, probably for 2 to 5 days or onwards. It affects your work. You talked about the exhaustion bit. It must affect mentally, your mental, psychological well-being. So what do you do for this?
And let me tell you, it's very sad, but on one of the international pages for where they do the advocacy for endometriosis, we got to read some very difficult news of a woman who committed suicide. And we know the burden of this condition, not only on the woman, but also on the people who are around her. So her workplace, her family, her husband, etc. But you know, we know the burden is not only on the people, but also on her from a physical perspective and also psychological. So like, we know mentally a woman is struggling with her self-esteem because one, she feels like there's a problem with her because one, she doesn't understand this issue. Secondly, doctors are telling her it's in your head. So you're crazy. And so some doctors are also not being fair to these patients. And then there's also the thing of marriages that are suffering. You know, one of the symptoms of endometriosis is infertility, because it's a third contributing factor of infertility. And you know, so if I'm unable to conceive as a woman, you know, it's going to affect my marriage. Then the other thing is that, you know, if I'm not able to enjoy sex with my husband or whoever it is, that is also going to be impacted, and I'm going to feel it's going to impact my self-worth, you know, because for a woman, a sense of fulfillment comes from knowing that I've been able to conceive, give birth, and take care of a child and be able to raise them, to become a person who then is going to be in society and play a key role. But if I don't get that, man, Dr. Ndegwa, I have seen it in the group. Women are stressed. Women are, you know, they're having negative thoughts with themselves. But I think one of the things which we also stress, you know, in the group is that if you're feeling that Dr. Ndegwa is unable to address the cousins of endometriosis, and we call them cousins, go see a professional counselor. Go see someone who is trained and can actually listen to you and actually tell you how to address some of the issues.
But how often does that happen? Because I find with my patients as well, mostly who are struggling with infertility, they do not want to see anybody else.
They dismissed.
Want to, and I think that's really a problem. They want to keep it quiet. They want it to be between me, the doctor, and my husband.
Absolutely.
But at the end of the day, I think psychologists do great work, and they are able to pinpoint your problems and know which questions to ask so that you are able to let loose. And sometimes talking with somebody who is a professional in that area really helps.
Yeah.
So I don't know if you've experienced any of that or have got any feedback from any of your people in the foundation.
I think it's not been forthcoming because it's not something we're able to track, like with or we've not set up a structure where we can actually be able to track what some of these people, like what they do with the feedback that we give them. Yeah. But we definitely have seen the impact of some of the people who have changed their lifestyle, because they come back with positivity. They have more energy, they're more willing to actually talk about, this is actually what I've done, and it actually made me feel better. I have better days, I have better mornings, and those are the things that we believe, okay, those are the things that are within our control. But you know what, we are praying that we would stop making period pain a taboo discussion. It's not.
It isn't.
Yeah. It's part of my anatomy. It's part of my physiology. So what we're not going to run away from this issue. But what we would really love is for also the people who are around us. If you know a woman who is suffering with this period pain, also try and get her to get medical assistance. But also, we're talking to the people who are around this woman, like, for example, husbands, men specifically. We know that you people also lack the capacity in terms of dealing with a woman who is suffering with endometriosis. Because one of the things which I had to do, and I'd encourage the women who are out there, tell your boss the name of your condition and what you're suffering from. Provide also like a doctor's note if they need that. But the most important stakeholder that you need to make sure is on the table about this condition is your husband or your boyfriend. So like my husband-elect, Mr. Odhiambo, he has been informed and he knows the challenges, that I go through every month. And all he asks, and which I feel a lot of men ask, what can I do to help you? There's nothing, imagine. Like all we want is we want to just lie down in the fetal position, hold a towel, hold a hot water bottle or something, and that's it. But we want you to acknowledge the pain with us and not dismiss it. I think that's the most important thing. If you do anything for us, just acknowledge the pain with us, because it's real.
It is real, and to be honest, a lot of husbands do. I have a lot of couples who come, who have and where the partner has endometriosis, and they come in. But sometimes they look so helpless. Even for me, I'm like, he can't do anything. But I think it's coming to fruition that men are understanding. Most of the men who come here with their wives really do understand, and I think they also though bear a huge burden. And I don't know if your foundation would want to do anything for the men who are supporting the women.
We really, in fact, I think there was one last post I did maybe last week, and I called on the guys, because let me tell you, one of the things that we are seeing is the people who respond to the posts more are men than women. Wow. So I don't even know what that is saying. It makes me so confused, Dr. Ndegwa. But I realized, I was like, here are men responding more even than the women. They're saying, Elsie, if it wasn't for you, I wouldn't have known about this condition. In fact, I know several women who I need to talk to. They've come for some of the events that we've hosted. But another thing is we really want them to become the ambassadors, to actually become the spread the yellow ambassadors on the ground, and actually tell women, if they see this woman is manifesting this symptoms or this, that, or the other, they will be the ones to actually force them and tell them you need to seek medical attention. And then we also want them to be the ones to just continue spreading and having the conversation, especially on social media, because we know that one of the spaces where we can actually begin to actually talk about some of these sensitive conversations is creating awareness through social media. So I really want them to become our champions, because we know there are men who are married to women who are suffering with endometriosis, who've been diagnosed with endometriosis, and they can also share their story about, you know, some of the things they've gone through. And so like this next, and I know we're going to talk about that next, you know, the next event, we're going to have guys come on the panel.
Oh, that's really good.
Yeah, and we're going to have them share, like, you know, what has been the impact of this condition, how has it affected your relationship. You know,
I think it's that would be perfect, because some men think, okay, is this woman trying to get attention?
Absolutely.
You know, is she calling me when I'm at the club at 3 so that I can get back home?
Exactly.
You know, so it's important for men to realize that other men have similar experiences and what they should do about. You know? So I think that's nice.
I think so that's one thing, you know, we're doing, and you know, we're really, really excited. Of course, we know that we're not going to turn it around in a day. But I think the most important thing is just to keep talking about it. We will keep spreading the yellow. We will keep talking about it until hopefully someone, you know, gets a cure. And you know, I think one of the things which I must celebrate is that we have our own local scientist in Kenya. Who's actually studying the pathogenesis of the condition. That for me is like huge. We should actually be celebrating that, because I know not many countries around the world have people who have got this passion
for endometriosis.
Yes, for endometriosis. And you know, we're proud to also have him on the board of the Endometriosis Foundation of Kenya. So we really believe one day, I believe Kenya will become the beacon of hope for Africa and hopefully for the rest of the world. I think we just need people to just get behind us and just, you know, just cheer us on. And
I was just wondering, Elsie, about how your foundation is going to assist women who are in employment. I have seen or heard from a lot of women that they've needed to change job constantly, or have been fired because of the time they take off during the time of the menstrual cycle when they're having intense pain. Is there something that you think can be done or should be done so that we really help these women?
I think one of the things that we do, you know, as endometriosis, I'll certainly talk about what I've done in my workplace. I've talked about the condition. I have educated, you know, my employer. I've just actually told them that, did you know that this is a condition, and this is the magnitude of its effect, and this is how it's affecting women. Women on average miss 2 days of work every month. And I know it's a lot, and I know employers are, you know, are on the losing end, you know, because that's workforce. So, and this is what we are highlighting about endometriosis. It is not only going to cost you as an endometriosis warrior, but it also costs your family, and then it also costs your employer, because they lose out on your man hours. But here's the other thing that makes it very, very, very sad. Is that these employers are people who dismiss people who are suffering with endometriosis, and they dismiss that pain. In fact, some people actually tell you you're either faking it, you're trying to find a reason to leave work. The other thing that they tell you is that, what is this work? I mean, what is this pain that is causing you not to be able to even do some? Some even dismiss it, they don't even take you seriously. And on top of that, they expect you to have delivered. But here is a condition that is costing a woman her life. Women have committed suicide. So we feel there is an opportunity for employers, to come to the table and understand this condition. If doctors, the gynecologists themselves, are also trying to understand this condition, I think it is only fair for them to be invited to the table and just help protect the women. There are countries around the world that are working very hard to protect the woman worker, and they are categorizing endometriosis as a disability. Why? Not only to protect her from, employers who are not going to understand her issue, but also to protect her from just the insurance companies who do not provide medical support for people who have endometriosis like me, because they categorize it as a chronic and recurring condition. I think for me, I'm not here saying that all employers are bad, because we've got some women who the employers are enlightened on the issue and they understand it, but we really would love for these women, for us to stop normalizing pain and stop dismissing it as, it's an issue and it's pretentious. So Dr. Ndegwa, one of the things which we must tell employers out there is that as the Endometriosis Foundation of Kenya, one of our responsibility, our biggest responsibility is to raise awareness on the issue. And part of that involves just educating the workplace on this condition. Just obviously talking about the women who suffer with endometriosis, how they suffer, what that looks like, and how to support them. So that's one thing we can offer. So if any employee, any employer wants us to come into their offices and actually talk about it, allow us to, so that we just destigmatize this issue around period pain and just and normalize it.
I think that is wonderful, and I think we definitely will be there for you. And I support. As I said, it's very dear to my heart, because it does affect a lot of my clients, and I see the struggle and the pain. So I'm so excited about this. But now, as we close, you could just tell us about the event that's coming up on the 24th.
Yes. So every year we join the global efforts in just recognizing the endometriosis warriors who are out there, and we just make sure that we give them a platform that they can actually also talk about their journeys, bring people, the experts, doctors like yourself, the scientists, the nutritionists, and we'll have a lot of people in the room who will talk about their journeys and their inputs to actually ensure that we are getting factual information about endometriosis, because there are a lot of myths out there. So we use that platform to just to continue just spreading awareness. And so the event is happening on the 24th of March at Power 254, and we'll start from about 10 o'clock to end at 2 o'clock. And I know we'll also be unveiling a snippet of a documentary that we're shooting that will just also help put Kenya on the map. So we are really eager to play the part and actually contribute to finding a solution for these millions of women.
So I hope you've learned something about endometriosis. Thank you so much for watching. If you want to learn more about the Endometriosis Foundation of Kenya, please go to their Facebook page, and we'll give details right down there. So look and get the details. And I just want to recognize all the women who are suffering from endometriosis and saying that we are also trying to spread the yellow, and we are there with you in your fight. And if you liked this video, or you have a friend who you think needs to learn about endometriosis, please share, please like, subscribe, and we'll see you next time. This is Dr. Ndegwa, and you're watching Footsteps to Fertility.